Welcome to the Red Roof Recovery Show. This is a program to soften the path of recovery from substance and behavioral addictions. And you know what? It's more than addictions. This is about life. I first want to thank my friend, my mentor, a very talented singer, songwriter, musician. His name is Russell Allen Scott. And he wrote this beautiful piece of music. It's called Greatest Bravery. And I find it such an appropriate theme song for this show because it has taken a great deal of bravery for me to start publicly speaking about my addictions to drugs and alcohol. But like I said, this program is about much more than just addictions. It's about life and the messiness that comes with life, and that includes mental health disorders like addiction. My name is Tanya MacIntyre, and I appreciate you spending the next 30 minutes with me as I share a variety of tools and techniques that have worked for me on my recovery path. And we're all different, so what's worked for me may not work for you. I encourage you to find something that works with you, something that resonates. And once you find something, you grab onto that and then do more of it. And sometimes, you know what, I'm very fortunate to have a guest join me, and I'm very excited for my guest here with us today, sharing their expertise on mental health disorders. Dr. Wendy Dryden is joining us from the UK. He has been working in the field of psychotherapy since the 70s, which happened to be one of my favorite decades. Dr. Wendy Dryden was one of the first people in Britain to be trained in CBT, one of my favorite therapeutic approaches in my recovery, cognitive behaviour therapy. And Dr. Dryden also became Britain's first professor of counselling at a London university back in the 90s. And you know what? I could easily spend our 30 minutes together listing Dr. Dryden's academic accolades, but you are able to do that by going to his website, wendydryden.com, where you can also view his latest books. Dr. Dryden, welcome to the Red Roof Recovery Show. It's so great to have you here.
I'm delighted to be with you today.
And may I call you Wendy?
You certainly may.
Thank you. Now, Wendy, in the addiction recovery field, we tend to have a model of recovery, and it's based on a minimum 30-day rehab stay, which is generally expensive and I think largely ineffective for a lot of people that I speak with. When I created Red Roof Recovery, I created a residential program, and it was my intention to prove that someone who is motivated, and I think that's key, someone who's motivated can overcome addiction in just 1 week. Now, that, of course, requires an aftercare program as well, but I think my approach is a viable and effective method of treatment. And I know that you specialize in many areas, Dr. Dryden. I want to focus today, though, on your expertise with something I find fascinating, and it's called single session therapy, SST. And what I find fascinating about this is that we have been socially conditioned and also academically conditioned to believe that it takes a long time to recover from mental health disorders like addiction. So I'm curious, Wendy, how did you come up with this idea that someone could be cured in a single session of therapy?
Well, if I can take that statement and sort of do a detailed forensic analysis of it. First of all, I must say this is not my idea. It was probably Freud's idea. Because on one of his vacations, a couple of his vacations, he was asked by a couple of people to kind of help him, which he did in one session. In one case, walking along the banks of a river in Leiden in Holland with Gustav Mahler, and helped Mahler overcome his sexual problems with his wife in short order. Unfortunately, Freud didn't take his own discoveries back into his own practice, so we had to wait a while. And I think that the person most credited with single session therapy development is an Israeli psychologist called Moshe Talman, who in 1990 wrote a book on single session therapy. And I read this book in 2003. I thought it was rubbish and left it. And then I came back to it in 2005 13, and I thought it was the best thing since sliced bread. So it's interesting how you can kind of come to an idea that the time isn't right for you, and then it's right for you. So I haven't created this. I've developed it. And the second thing I'd want to sort of take issue with you, Tanya, if you don't mind, is this idea of cure. So I'm not trying to cure anything. I think, I often say, and this is really interesting coming from a sort of person who's Jewish. The only thing I can cure is ham, right? I can't cure human beings, But having said that, I think single session therapy is a remarkable way of actually providing help at the point of need, without having to wait for help, and without having to spend an enormous amount of money on one's own sort of mental health, well-being. Now, single session therapy can either be by appointment or by walk-in, and it's interesting. It's sort of ironic that I'm talking to you in London, because Canada is the home of single session walk-in therapy. I don't know if you knew that.
I did not know that.
Particularly in Ontario, it's got the greatest number of single session walk-in therapy clinics in the world. So, I'm going to give due credit to Moishe Talman. I'm going to give due credit to my Canadian colleagues, because they deserve it. But I think what single session therapy does offer is saying, look, let's not clog up our time together with taking a history or doing a full assessment or doing with this, that, and the other. Let's get down to business straight away. And that's what I think single session therapy is. Let's get down to business. Let's see what happens at the end of the session. At the end of the session, more help's available if you want it. It's not just one session and that's it. It's let's see if we can help you with what you've come with in one session, and more help is available should you want it.
So you have a very specific way of setting people up for this, though, because they need to do some preparation as well before they come into the therapy session. So it needs to be very specific. They need to do a little bit of preparation time as well. And it needs to be...
Well, I don't think they need to. I think the process is enhanced. And I say this, that they don't need to, is that I at the moment, I do a lot of live online demonstrations of single session therapy. I've done over 600, none of whom have actually prepared for the session. So it's not necessary, but I think, with people coming in, first of all, what's really important, Tanya, is that this is based on informed consent. This is based on the idea that clients should not be compelled to have single session therapy or any other approach to treatment. And also clinicians should not be compelled to practice it if they don't want to. And believe me, there are plenty of clinicians who don't want to. But so I think this is an informed consent. And when you do give your informed consent, what I say to you is this: look, if you want to prepare for the session and get the most out of it, let me send you a form and really, really kind of take it seriously, and then share it with me so I can understand your thinking, so that we're both to some degree prepared, at least to know exactly where we're going to place our attention, and let's see what happens from there.
I find it interesting that you mentioned reading Moishe's book back in the 90s and thought it was rubbish, and then you read it many years later and suddenly it's great. And I love how we do that. We evolve because scientifically minded people hopefully do evolve with our experience. And I do believe when the student is ready, the teacher appears. It's an old adage that certainly rings true for me on a regular basis. I've experienced some aha moments in a brief encounter, but I definitely needed to be ready for that encounter. So I'm curious, Wendy, do you agree that there needs to be not only a motivation factor for someone who says they want help, but also a connection component between therapist and student, or therapist and client, whatever that relationship is?
Yes, I think that the research shows in all types of therapy that the client is going to get most out of the work if they have a good working alliance with the clinician, with the therapist, or with the helper. In single session therapy, what that means, I think, is that we show that we're keen to help the person. We're focused on what their goals are. We take their goals seriously. We're not kind of sitting here thinking, well, the client wants this, but I can see that they really need to deal with that. No, we actually take the client's goals seriously. We work towards helping them to achieve their goals. And in doing so, that we show them respect as an individual. We're transparent. We show them what we can do, what we can't do. And we also show that we understand them from their perspective, but also to actually kind of inspire them with hope that things can be different.
I think the element of hope goes a long way, because I've talked to countless people who have seen countless therapists, and the experience has been a negative one. So they become hopeless in their position that, there is no help for me.
Well, I think part of that, I think, is, and I think, luckily, I think the field is moving away from this. Part of that is that, as therapists, and I can understand this, that we focus on people's weaknesses, their problems. But, people are very complex, and they have their strengths, they have their resources. And what's happening in the field, there's a strand called strengths-based therapy, where the therapists are actively looking to encourage the client to identify and utilize their own skills and their own talents, their own strengths, resources in their own recovery process. And I think when that is done, then that actually brings more hope. But if you just focus on what's wrong with people, I think that can be dispiriting.
I listened to one of your single session therapy workshops you had done on, I think it's called the Weekend University. And you told the story about how conscious you were of your stammer. And I didn't even notice you had a stammer before you brought attention to it. And how you were able to overcome that quite simply. And it demonstrated how effective these aha moments can be, I think, when we feel stuck in our own belief systems and seeming limitations.
Mm-hmm. That's right. It was really, having listened to a man called Michael Benteen talk about his life on a radio program in England. But in about a minute of that interview, he talked about his stammer. He talked about how he developed the attitude that if I stammer too bad, and I wasn't going to hide away. And I thought that, nobody had really kind of showed me any psychological way of dealing with my stammer. They were too busy kind of teaching me kind of techniques so that I don't stammer. But if you can have the best techniques in the world, which at that time, I'm afraid we didn't have the best techniques in the world, but you could have the best techniques in the world and have a lousy attitude, and you wouldn't be able to use those techniques. So I did develop that attitude that Michael Benteen suggested, and I ran with it. I utilized it. I stopped changing the beginnings of words so that I didn't stammer. And temporarily I stammered more, because if you stop avoiding that, you do stammer more. But I persisted, and I actually developed a non-anxious attitude, which has a great impact on whether you stammer or not. And so, the thought when I was 19, if somebody said to me, you're going to be spending half an hour talking to Tanya MacIntyre and loads of people are going to be listening to you, it would have filled me with dread. I would have rather probably kind of, cut my own throat than do that. But now I can do that, and I'm enjoying doing it. And actually, what I found was that rather than fear public speaking, I tolerated it, and then I recognized that I enjoyed it. And I think that process where you kind of go from being anxious to toleration to perhaps enjoying something is something that I sort of utilize in when I share that particular story with relevant clients.
I think what we practice grows stronger, and that can be good and bad, certainly. So I think having the courage and resilience to keep going with something. You know, when you set out a plan, like you said, you listened to this interview and you felt hopeful that you could accomplish the same thing if you adapted that attitude. But it also took, I think, a willingness to stay the course, practice patience, persistence kind of deal.
That's right. And I think that, you know, too much of the time people are looking for quick fixes which are going to be free of discomfort, and I think that rarely happens in our field.
Absolutely. You've mentioned single session therapy is unlikely to bring about fundamental changes in personality. And I'm curious, what can, if anything, affect fundamental changes in someone's personality?
Well, I refer you to a book called Quantum Change, which was written a number of years ago, where some psychologists looked at the idea of what type of experiences leads to fundamental personality change in a fairly short period of time, and they tend to be issues of religious and spiritual transformation, and which kind of so interested me as an atheist, but one has to be open-minded, and so. I think the story that I give about, which is more from literature than from real life, is Scrooge. Scrooge, who went to bed on Christmas Eve as a curmudgeonly old man, and after 3 single sessions with 3 rather ghostly single session therapists, emerged on Christmas morning fundamentally different in his approach to human beings. And I think what motivated him was the vision of his funeral, where nobody attended, and people were kind of looking at it saying, "Oh, he was some miserable old sod. I'm glad he's gone." And that was actually really quite motivating. That change. So, but I think that spiritual, religious sort of transformation. We need to understand more about that. I think that's a poorly understood phenomenon, because I do think it does have sort of implications for the work that we do. Not that I any way that I want to kind of promise any kind of fundamental change as a result of single session therapy, but what I do find is that the people tend to take one thing that is meaningful and that they choose to apply, and they make a difference in their lives. And that's what I'm trying to do, to try to encourage people to find something that's going to make a difference that they can put into practice as a result of the session that will make a bit of a difference to them.
I remember reading a book. My father gave me a book when I was graduating from high school in 1979. It was written by a psychiatrist, an American psychiatrist called, I think Jeff Beck was his name. And he had talked about, in his practice, there were 2 primarily kinds of people. There were the people who suffered with what he called character disorder. And the character disorder people felt that they took all the responsibility for everything that was going wrong in their life and in the world, primarily. And then the other group of people were the neurotics, people suffering with neurosis. And on the flip side of the coin, they were the people who didn't take any responsibility for anything that was going wrong in their life. And he said there was hope for the curing of the character disorder people, but very little hope for people who were suffering with neurosis. And I'm wondering if you recognize those similarities in your practice.
Well, I think that the what I do, I mean, I'm always a bit concerned about when people say there are 2 types of people, but I think that the principle is there that I think if you don't take any personal responsibility for your emotions, for your behavior, then change is really kind of difficult. However, if you take too much, and I would say that's I recognize that as one of the factors of chronic guilt. If, people who have chronic guilt have the kind of attitude that when I am involved, I have to make sure that everything goes well and nothing goes badly. And if I fail to do that, it's all my fault and I'm a bad person. Now, with that attitude, you can actually do something about. But with the people who don't take any kind of responsibility, you do have to work with them to see if you can encourage them to take some responsibility. And sometimes you succeed and sometimes you don't.
Absolutely. When dealing with life's adversities and general messiness, I think we can often get bogged down by lots of heightened emotions. I've certainly experienced that. These emotions can range from anger, frustration, impatience, intolerance, hopelessness, and all of that can lead to mental health disorders like depression, anxiety, addictions. So what I love about REBT, Rational Emotive Behavior Therapy, is that I've learned to separate my self-worth from the negative feelings that feed these countless unhelpful emotions. I think our value as a human being is totally separate from our behaviors. Your value, your self-worth is separate from everything and everyone around you. It's a hard concept for a lot of us to grasp. In order for me to maintain my abstinence from drugs and alcohol, I've had to learn to develop my self-worth and my value independent from outside circumstances, perceived realities, and society's opinions of me. This is not an easy task by any stretch of the imagination. We live in a judgmental, punitive world, especially when you're afflicted with addiction. Still, one of the most stigmatized conditions on the planet. It aggravates me to no end. So I'm wondering, Wendy, is it possible that resistance to recovery in general isn't because there's something wrong with us, but maybe because there's something right with us?
And I'm not quite clear what you mean by that.
Well, I think you made reference to the strength-based approach that we're taking to therapy.
Right.
So is it more helpful, I think, to lead people to what's going right about what's wrong in their life?
Yeah, I think if we lead people to see that there's a both and. Yes, there are things going wrong in their life, but they also have, the wherewithal in other areas of their life which they kind of transfer. I often have this concept where I see part of my work is reintroducing the person to aspects of themselves that they have forgotten about. And I think when you do that, and the idea that you mentioned, developing self-worth, and I think that is a lifelong activity. It's an idea that you can grasp, but if you really want to develop that, it does take really time to kind of really understand the concept, really see how that's going to sort of affect your life, the importance of acting in ways that support that idea. I talk about, helping somebody towards greater self-acceptance, because I don't think we will ever achieve it once and for all and that's it. I think somebody's said it's a bit like cleaning your teeth. You never say, that's it, my teeth are perfectly clean and I don't need to clean them anymore. So there is a development aspect to it as well. And I think that one of the things that we really do need to do, and I think in single session therapy you can do that, and that is to say, yes, you can take something from this, but your choice is whether you just see it as an interesting concept but don't act on it, or you can commit yourself to doing it. And that's why I utilize my example of overcoming my anxiety about my stammer. I took an idea and I ran with it, and I actually ran with it through thick and thin. And we have the capacity of humans to do that. We have the great capacity, if it is worth it for us, we can see it. We have the great capacity as human beings to run with something that we see is going to be helpful to us through thick and thin.
And I think it's helpful when we are aligned with somebody who's supportive and compassionate and encouraging. Someone like you.
That's right. I think it certainly does. I don't think we absolutely need that, but I think it certainly can be quite. I had nobody to encourage me to actually implement what I learned there. But I'm sure that if I did, it would have been useful for me. So yes, I think that the idea of having people on your side, and that's what we say in single session therapy, not only look for strengths within yourself, but resources within your environment, and utilize those strengths for good rather than against you.
Absolutely. I think we do become the company we keep. Absolutely. We're products of our environment and products of the people we're hanging around with. So striving, I think, to keep our company positive and supportive and encouraging is very important.
Having said that, Tanya, I'm a great believer in other words, also hanging around your enemies, because your friends are going to be too nice to you. Your enemies are going to kind of criticize you and be nasty to you. And I think we need some of that in order to develop some sort of resilience, to adversity. So, yes, keep your friends close to you, but utilize, the power of your enemies, because they can give you the adversities which you need to kind of, develop resilience.
Yes, I agree. Well, Dr. Dryden, thank you so much for your time. It went by very quickly, too quickly, but I have learned so much in our 30 minutes together. Thank you, thank you, thank you.
It is my pleasure, Tanya, and I wish you well with your podcast in the future.
Thank you, Dr. Dryden. Cognitive behavior therapy, rational emotive behavior therapy, mentors like Dr. Dryden have been crucial components in my recovery from drug and alcohol addictions. Dr. Wendy Dryden is an expert in rational emotive and other cognitive behavior therapies, and I encourage you to connect with Dr. Dryden on his website, wendydryden.com. You can learn more about single session therapy. There's lots of other resources there, and you can also view his latest books. Dr. Dryden, thank you so much.
Thank you very much, Tanya.
I've authored a couple of books I'd like to share with you. Mindful Wisdom from My Philosopher Dad, Sage Advice from a Single Father. My dad raised me as a single dad back in the 60s while struggling with his own addictions. He was an extraordinary man who deserves a legacy of greatness, so I also wrote a second book in his honor. This one is called Daily Wisdom from My Philosopher Dad, and I set this one up more like a daily journal, so you can take some time, reflect on the daily inspirational messages. And I encourage you to not only buy my books, but also take some time on this daily wisdom book to reflect on the inspirational message and then write your thoughts and intentions for the day. I find the power of words very powerful, and the power of the written word is magical and sometimes even transformational. It certainly has been for me. My wish for you is that you always live fully, laugh often, love always, stay mindful and positive, use all those healthy chemicals that we've got roaming around in our body and brain. Remember to be kind to yourself. Talk to yourself like you talk to your best friend, assuming that you talk to your best friend with love, kindness, and compassion. And remember, there is great power in knowing that the only thing we can control in our life is ourselves. My name is Tanya MacIntyre. Thanks so much for being here. Remember, we talk to ourselves in our head more than we talk to anyone else. So let's make that effort to make it a nice place to be. May the force be with you. And remember, you are the force.